This is Dr. Paul Aschinberg, and today is May 25th. I'd like to start by wishing everyone a happy Memorial Day, and hopefully, even under these unusual times, everyone can have a nice day and hopefully enjoy it with their family and loved ones. As we go through Memorial Day, some of the numbers on the coronavirus crisis continue to rise. Today, unfortunately, we will likely cross the 100,000 deaths milestone, which is certainly a very grim and somber number, and we will soon be reaching 1.7 million cases. As sad and tragic as these numbers are, this week has also had some good news. If we look at the graphs that we've been tracking over the last few weeks, this is the chart for the number of deaths every day from coronavirus. And as we can see, we've passed the peak and have a very nice downslope in terms of the number of deaths every day. There are fewer and fewer deaths a day from coronavirus now than there were several weeks ago. And this is certainly a very, very encouraging trend. As we look at the number of cases of coronavirus in the United States, we also see that it looks like we're past this peak and coming down, maybe leveling off a bit. Now, the change in cases is not quite as dramatic as the change in deaths. You saw that the change in deaths kind of went down more sharply. I think this has a lot to do with the fact that we're testing more and more people now than we were back here in March and April. And so we're picking up a lot more cases that are of people who are not quite as sick. And so this graph does not quite compare apples to apples the way the chart for the number of deaths does. And so I do think that the number of severe cases and deaths are coming down, and that this is leveling off a bit because we're picking up more mild disease now that we were missing back in the past. So all encouraging numbers over the last week or two. Here locally, we're seeing very similar results. We're not quite seeing in Illinois the drop like we are nationwide. We're seeing more of a sustained leveling off. This is of the number of cases here that are now leveling off. And then in Illinois, this is the number of deaths that are now leveling off and possibly starting to drop as well. Now, even though these are statewide numbers, this is not quite the trend for most of the state. In fact, every county in the state, except for Cook County, where Chicago is in, has already seen a marked leveling off or a drop in cases. It's really been Chicago and the big city where a lot of people live close together and it's harder to contain the spread of infection that's kind of driving these numbers and not having the state numbers look like they're dropping off. For most of the state, the numbers are actually even better than what we're seeing here, which is very good. And that's why on May 29th, we will be entering phase 3 of reopening, which means that many retail stores will be able to open, and as long as they're not packed with people and practicing social distancing, we will now be able to go into stores. And even restaurants have been given the green light to open up as long as they serve fewer customers and do it with outdoor seating. So no eating in restaurants indoors yet, but perhaps some outdoor eating can start now too. And this is, of course, a very big step forward, and hopefully we'll be able to take more steps as the numbers allow us to. Now, as good as some of these trends are, we do have to keep in mind that all these improvements, particularly this one with the number of deaths coming down, has been the result of a lot of huge efforts by society of sheltering in place. And for about a month and a half, that was being followed very strictly by pretty much the whole country. And also the effect of the warm weather now. It does appear that not so much high temperatures, but the strong sunlight does help destroy the virus. And so when people are outdoors and perhaps someone who's sick, the virus comes out of their mouth and nose, if there's a lot of sunlight, that can destroy the virus and prevent the spread. So we're really benefiting right now from all the hard work that everyone did and the summery climate as well, which is helping. We have to keep that in mind as we reopen, because as more and more people start mixing again and the colder weather comes in the fall, there is the real risk of a second peak and things going up again. So we cannot take this downward trend for granted. And as we reopen, we have to do it in a smart way to minimize any risk of reopening, and we also need to take advantage of this time to prepare for the fall, for a time when we know there may be a risk of a second wave. So we have 2-3 months now where as we reopen, we can also be preparing for the fall and winter. The last video did generate a lot of very good questions, especially as we reopen, and I would like to try and address some of those today. There were a lot of questions as we reopen about, should I wear masks when we go outside? Can my kids play with other friends? Can we go to the pool? And so I would like to address that a little bit. So first, the masks. Yes, it is important that when you go out, you try to wear masks or face coverings as much as possible. Masks and face coverings are not quite as effective at preventing ourselves from catching the infection, but they can be very helpful at preventing the spread, because we know many people are infected and don't even know it and could be spreading it around. And so if we all wear face masks or face protection, then we can really prevent the spread to others. So some people were concerned that they have young children and that their young children may not keep the mask on, that it won't fit well. And that's okay for young children. Certainly kids under 2 or 3, 4-year-olds who just won't keep it on, do the best you can. As long as most of us are wearing our masks when we're out and about, that will prevent the spread. And certainly if you're at the grocery store and you're in an aisle and you see 3-4 people with no masks at the other end of the aisle, that might be a good idea to turn around and go to another aisle first until that breaks up. Because again, you're more at risk of people not wearing masks, and that's what we want to try and avoid. In terms of seeing other people, starting to go out more, yes, of course, as things reopen, we should be able to go out more as long as we do it in a smart way. So if you have children, if you're a family, the way I like to think about it is as kind of the circle of friends or a circle of contacts. Right now, or while we were sheltering in place, that circle of people we could be around was really just our family at home. And now as we're reopening, we can slowly expand that circle to include more and more people. It shouldn't include everybody. So at first you want to expand the circle to maybe a few of your kids' friends, some family members, and really try to focus on just being with those people. And then as things hopefully continue to improve, we can slowly expand that circle to include more and more people. In terms of your children, if they're playing with friends, it should really be outside. Try to keep them out as much as possible. The virus is much harder to spread outside than inside. So I don't know that I would recommend, having 4 or 5 of your kids' friends over in the basement to play video games right now. That's probably not a great idea. But in terms of having them do things outdoors, outside, that would be great. And, kids outside may not always wear their masks great, or if they're playing sports, it can be hard to social distance. But again, if they're with smaller groups and outdoors, I think that would be reasonable to do right now. And as much as they can when they're outside with their friends, to try and keep the masks on and some social distancing would be great. In terms of pools, yes, a well-chlorinated pool, we do not believe that the virus will be able to spread in a well-chlorinated, well-maintained pool. Having said that, if you are in a pool with groups of people, your family or your child and friends should try to stay away from others in the pool, not because the virus will spread through the water, but if someone breathes on you, coughs on you, that can still spread through the air even while you're in a pool. So the pool should be okay as long as you do try to practice social distancing while in the pool or while out of the pool, on the beach chairs and things like this. So do try to do these things in a safe and judicious manner. Some people had more questions about these inflammatory diseases in children, and fortunately there has not been a big number of spike in deaths due to this. And just to review from our last couple of videos, it does appear that coronavirus can trigger what are called inflammatory conditions in children. This is where the virus kind of triggers a huge amount of inflammation in children's bodies, and that inflammation can occasionally overwhelm the children's bodies and has led to a few deaths in New York. Again, this is very, very rare, and even with these deaths taken into account, in children under 15, the flu has killed more people than coronavirus. So even though these, when you read reports about this in children, they're very scary, but they're still very, very rare. So it's something that's evolving. We're going to keep an eye on the data, but thankfully for right now, a very rare event. Another question was, does asthma pose a big risk to children or adults when it comes to coronavirus? So kind of like this inflammatory disease, children overall are at such lower risk with coronavirus that even though asthma may increase their risk a little bit if they catch coronavirus, overall, even children with asthma are still at very, very, very low risk. And the United States, of the 100,000 deaths up to last week, only about 12 were in children. So and that includes all children, sick children, children with asthma, children with cystic fibrosis. Among all children, only been 12 deaths out of the 100,000. So very low risk. Now, as you get older and into your adult years, or certainly more elderly, then yes, asthma plays a much more significant role and increases the risk much more. And so for adults and the elderly with asthma, you should spend more time sheltering in place and being more cautious when going out. So everyone's risk is a little bit different, and that should be taken into account when you decide how much to go out now that we are reopening. Not everyone's risk is the same, and that needs to be put into the calculation. I did discuss last video some of the treatments that are promising, including remdesivir and convalescent plasma, and some people had questions about hydroxychloroquine that they'd heard about, and is that not effective? And certainly early on, there were some reports that hydroxychloroquine, which is a drug that was used to treat malaria originally, may help with coronavirus, and it got quite a bit of publicity. But unfortunately, the studies that have come out since then have not been as encouraging, and in fact, it showed that some people are prone to getting irregular heartbeats that can become dangerous with hydroxychloroquine. So at this point, hydroxychloroquine, although it's still being looked at, does not seem as promising as some of the other medicines I had discussed. So unfortunately, when you don't have a lot of the data, sometimes that early data that comes out can mislead you a little bit and is not always accurate. And it seems that may be the case with hydroxychloroquine. Some people also had questions about some of the testing for coronavirus, and had questioned if getting the flu shot can make your test come back positive when you test for coronavirus. Now, when it comes to testing, I think it's important to discuss the two types of testing that there is for coronavirus. So the first test is the swab in the nose, and that's to tell you if the illness that you have at that time, if the runny nose, cough, fever symptoms you have right then are from coronavirus or not, and that's from a swab in the nose. Then there's also a blood test that you can do to see if you had coronavirus in the past. And so those are two different tests, and sometimes people think the blood test can also tell you if you're sick currently with coronavirus, and that's really not how that works. So the swab is to know if you're sick now with coronavirus. The blood test is to know if you were sick in the past with coronavirus. So the swab, if it does test positive, is quite accurate that you do have coronavirus. And that usually doesn't get confused with having gotten the flu vaccine or other problems in the past. A positive test on the swab can be quite accurate. A negative test on the swab is pretty accurate, but not as accurate as the positive. The test can miss a few cases of coronavirus. The blood test that looks at if you did have the coronavirus in the past, that's the one that has a lot of what are called false positives. So a lot of ways that you can get a positive test even if you never had coronavirus. The blood test, unfortunately, is not quite as accurate as we would have liked at this point. And so that's where you hear some people saying that the blood test was positive, maybe because they had the flu vaccine, maybe other more mild coronaviruses, like some common cold viruses are coronaviruses. And so if we had a common cold recently, that may cause the blood test to be positive. So there are certain things that can make you have what is called a false positive on the blood test. and that's not quite as reliable right now as we would like. But again, this is all stuff that's getting made better and better every day, and that's part of what I was talking about, that over the summer we really need to prepare for the fall, and improving the testing is a huge part of that this summer. Couple of other questions. Someone had suggested, that if in order to not fall behind on vaccines, could we have some sort of drive-up service at the office where we give children vaccines in the car? And we've thought about many different ways of being as responsible as possible, and we did indeed think about giving immunizations in cars, but we feel that that could put both the children and our nurses at risk. When you have a 4 or 5 year old who is thrashing around not wanting to get a shot and trying to secure them in the car to try and give them a vaccine, especially if it's windy or raining out, could create quite an unsafe situation. So we have not gone that route, but we have taken many steps to try and see patients as responsibly as possible. We screen any patients who are calling sick, and if it seems they may have coronavirus, we see them with telemedicine so they don't have to come into the office. We have certain hours where we only see well visits, so that way well and sick people don't mix as much in the office. And we've certainly we're seeing much fewer patients than we usually do, so there's no groups of patients having to wait in the waiting room for long periods of time, so that we can keep the flow in and out. Those are just a few of the things we've been doing. So although we haven't gotten to the point of giving vaccines in cars, we are taking many steps to try and ensure the safety of our patients. Lastly, people were asking if I think school will start in the fall. And certainly that's still several months away, but yes, I do believe school will start again in the fall. I think there will need to be steps taken to help with social distancing and make sure that this is done in a safe way, just like we're doing in the office, to ensure our patients can be seen in a safe and responsible way. But I think the data does suggest that it would be very reasonable to restart school and reopen schools in the fall. Keeping 20% of our population at home, those are kids, school-age children make up about 20% of the population, which then can lead to parents having to stay home. That has many downstream effects, which I think are negative to society. And I think, at least for the data so far, shows that the risks are still relatively low. And so I do believe that school will reopen in the fall. And certainly there's a lot of data to discuss on that front. And if people are interested, we can discuss that in a future video. But just to summarize it, I do think school will open in the fall. So as always, thank you for all your kind comments and questions. As news comes, I will try to post again. And if there are any other questions or topics related to coronavirus that you would like me to touch on, please feel free to post those on the Facebook site. Until then, be well and stay safe.